when you have recalcitrant or recurrent or chronic foot, ankle, or knee pain, one of the most important structures to hit is the talocalcaneal joint capsule. So a capsule is a tough fibrous covering that keeps the synovial fluid in a joint to make it work properly, to help it to function, to help it to glide. What happens is that the ligaments that go over the top of that capsule or part of that capsule will get injured, like say you sprain your ankle or injure yourself otherwise, and then they tighten down. So now you don't have joint capsule space. So you have to have space in that joint capsule for you to have the proper motion. If you have improper motion at the ankle, that will cause the ankle to hurt, it can cause the foot to hurt, it can cause calf problems like shin splints, plantar fasciitis, but it can also cause chronic knee problems. So let's take a closer look at where those structures are and how you might push on them. Okay, so here we are. Here's the lateral malleolus on the right foot. And if we come below that malleolus and you kind of feel there's a depression that comes at an oblique angle here. So what we want to do is push into that. That's where the joint capsule is. In fact, kind of all the way around that malleolus. So we want to press in there and then have the patient either passively, you rotate their ankle, or if it's you push in here and then you rotate your own ankle in a circle. And so you're trying to get that capsule. Now there are ligaments that attach, the posterior talocalcaneal, middle talocalcaneal, anterior talocalcaneal. You might have to push on any one of those and figure out, because again, ligaments are thickenings on the capsule. Or is that moving appropriately? Okay, go ahead and do a circle for me again. There you go. So that's where you want to look. Now let's say we wanted to look at the inside portion of that. So I'm just going to pick the other side so we don't have to move here. Same deal. You can see that the tibia comes down and is this, what we call a medial malleolus. And anywhere around that circle is going to be the posterior talocalcaneal joint, is what we would call this. So the calcaneus comes into the talus, particularly right here in this area where there's a couple of tendons coming through. Very important. And again, same thing. Either you move it passively in circles as you hold that, or you have the person just twist their ankle in circles. And you have to do this multiple times a day in order to get this to change. The other part of that is you might just push down on the heel, trying to get that tough fibrous capsule to stretch. And pretty soon there'll be some pops and some clicks, and you'll get better range of motion.